Well, we know that therapy can certainly be expensive and not often covered by insurance. That doesn't make it any less important, though, to take care of your mental health. This morning, Dr. Cheryl Ziegler is with us. She's our 9News parenting expert and a licensed therapist, and she's talking about some ways to take care of yourself while on a budget. This is important, so thank you for being with us.
Yeah, I have a list of things. Today is going to be like a marathon of information in a short amount of time.
Well, let's get to it. What do you have for us?
Okay, so I do want to say you don't have to always spend a lot of money. There are multiple resources. So first, let's start with university counseling centers.
Yes.
They have doctoral students, even master's level students that are practicing. So it can be a great place to get therapy, testing, and assessment.
Yeah.
So we'll start there. But also, there's your own insurance plan. So if you call your own insurance plan, you want to ask for things like, do I have out-of-network provider benefits? And that means, okay, we'll pay a certain percentage if they're out-of-network. If they're in-network, what would be the copay? What are the limits? It really might be worth people's time to do that because sometimes there's just a small copay and you can actually get therapy covered.
True.
So try it. Another thing to do is ask for something called sliding scale.
Okay.
So a sliding scale in our world means, okay, depending on what your income is, I will adjust my fee so that I can make this reasonable for you to access. So go ahead and look online or just call people and ask them, do you offer a sliding scale?
And are there a lot of therapists that offer that kind of service?
There are a good amount, yes. It really, in our field, we really want to help people and we want to be accessible. So some people do, a good enough amount of people do that it's worth looking for that. Another one is something called EAP benefits. And what that stands for is Employee Assistance Provider Benefits. So that's your employee assistance plan. And in it, a lot of times are 8 to 10 sessions. I've been looking it up and it's like the stats are maybe 9 to 11% of employees take advantage of this. So just inquire, ask HR. If you work for kind of a larger company, ask them, do I have EAP benefits? Often they can apply to yourself and to your children if you're looking for something for your child even. More things are group therapy. It's a great way to get great therapy within a group, less expensive. Something called bibliotherapy, which is really finding workbooks and books out there that are, approved and you work along with it. And you just do it at home on your own.
Yeah.
It's really quite effective. And then there's apps. And within apps, you can get research-based CBT kinds of prompts or places to put feelings, logs and journals.
Yeah.
And that can be really impactful too.
And you said those letters, CBT, cognitive behavioral therapy right there. That's going to be the most common form that when you think of your standard therapy sessions, that's what you're getting right
That's
there.
right. Cognitive behavioral therapy is a gold standard of treatment in most of the depression, anxiety, and things that we see. It's a great place to start no matter what's happening in your life.
So what would you say to anybody who's, listening to this right now? They're like, y'all don't get it. I truly can't afford it. What would you say to them?
Well, there's also community mental health centers. So within every county has a community mental health center, and they can offer free or very low-cost services, and often they are the ones that take Medicaid and Medicare. So those are also great places to go, and again, you look within your own county. Yeah,
and bringing it back to the point, if you've got a university in your area, and thankfully Colorado has plenty, they usually offer those services at a very low price, sometimes even for free.
Yep.
Dr. Ziegler, there's always an option. We see people to use it.
Yes,
All right.
thank you.
Thanks so much, Dr. Ziegler. Let's get a check of your forecast now with Ed.